California, which broke a new record today with more than 22,000 new COVID cases. The governor has announced regional stay-at-home orders that will be triggered if and when ICU availability dips below 15%. And today, the San Francisco area announced it's locking down beginning this weekend. We're joined now by California's Health and Human Services Secretary Mark Ghaly. Thank you so much for your time, Secretary. So Governor Newsom announced that 327,000 doses of the vaccine will be coming to your state in mid-December. But states like Texas have announced that they've received many more doses. Are you satisfied with this number, and how challenging will it be to figure out who gets in line first?
Yeah, thanks for the question. We're never satisfied. We always want to get as much of the vaccine as we can get, but I will tell you we're in constant conversation with our federal partners, and we believe this first allocation is the 327 is what we start with, but we know in days and weeks to come, we'll be able to announce even more vaccine coming to the state, certainly on par with our large population compared to other states as well.
And California has said that it will independently review any vaccines before distributing them within the state. How is that process going? And will it lead to any delays in distribution, particularly with Pfizer so close to authorization?
Yeah, let me answer the second part first. Absolutely not. We are already reviewing phase 1 and phase 2 of the FDA data around the Pfizer vaccine, expecting to do phase 3 right around the same time, within hours. And we don't think it will at all influence or delay when we can begin administering vaccines in California.
Now, some critics say that California's regional stay-at-home orders unfairly penalize smaller counties that are lumped in with bigger cities with more virus spread. And on the flip side, some wonder why stay-at-home orders aren't statewide. How hard is it to thread that needle and get it right, particularly in a large state like California?
Yeah, I'll remind you, some of these regions that we have in California are bigger than even medium-sized states. So, it is a challenge. And I think we've always said we don't live in the aggregate in California. There's a lot of difference between north and south, our coastal and our inland areas. But we did look at how to set up our regions. And the fact is that the virus spreads in a geographical, regional way. And our hospital systems are also set up in such a way. So the approach of a regional stay-at-home order felt like it was a way to be targeted, but also recognize the tendencies of the virus and make sure that we get it right.
Now, some states have talked about putting teachers near the front of the vaccine line as essential workers, but California is one of the few states where many school districts never reopen. How will you make reopening schools a priority as the vaccine rolls out?
Well, even before the vaccine rolling out, it's a priority. We're working closely with our county leaders and, frankly, all of our education partners across the state to make sure that we create environments where we can focus on safety of staff and students, provide all the protective factors that we know make a difference. And a number of school districts and schools across our state are open. I think the vaccine creates another exciting opportunity to create more protection so that we can bring more schools back to in-person education early next year.
And lastly, you and your colleagues continue to warn that we're in the worst moment of this pandemic, that we haven't even seen the full Thanksgiving surge just yet. What do you think will ultimately stem the tide, and do you see any glimmer of hope?
Well, there's a lot of glimmers of hope. I would say that one is the vaccine, but it's not here today. And that's why we need to keep our guard up and use the tools we know work. California emphasized a stay-at-home order with our regional approach. And it really is to avoid mixing as much as we can. We know this is really hard for individuals, for families, for communities, but the tools that we can employ now really will save lives. Buy us a little bit more time as we get the vaccine rolled out and really get us through this difficult third wave. But I think it's a critical time. We're close. A lot of good things are happening on the horizon. So staying focused now, I think, will serve California and, frankly, the entire nation really well.
Dr. Ghaly, thank you so much for your time. We appreciate your insight.
Yeah, thanks for having me.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.